Hi everyone, welcome back. So today we're talking about braces. In order to correct the position of the teeth, we need something called orthodontics, aka braces. This is the most conservative way to change the smile to an aesthetically pleasing one. There are two types of orthodontic appliances. Number one, fixed braces. Number two, removable appliances. Fixed braces can be regular conventional braces or something called fast braces. Your orthodontist or your dentist will be able to tell if you qualify for either one to fix both your smile and aesthetics and your bite. Generally, fast braces is a system that works quite fast and will be able to align the teeth in a very short amount of time. However, as I said, not all cases qualify for it, so you should speak to your dentist about it. Removable appliance, on the other hand, is something that you wore probably as a child, and also something like Invisalign, which you wear 22 out of 24 hours a day in order to correct the smile. Invisalign is a popular system taking the world by storm because they are clear aligners that won't really affect the aesthetics of your teeth while you wear them. Patients' own diligence and care is crucial to a successful treatment. Patients need to be quite exact on their appointments. They need to keep very good oral hygiene at home, as well as comply with the directions given by the dentist during and after the treatment. After the treatment, the patient will get a fixed retainer and a removable retainer. So the fixed retainer looks something like this, where it attaches on the inside of your teeth, basically, and this is the outside of your teeth. Ignore this stuff. But this is the outside of your teeth. So on the inside we put a fixed wire, fixed retainer, we call it, so the teeth won't move. The removable retainer looks something like this, where basically it's clear and patient will wear it at night before bed and remove it in the morning. So it's very important that the patient comply with these directions after the treatment. If the patient will notice that the fixed retainer is detached or something happened to it, it's very important that the patient goes to the dentist, lets them know so they can put back the fixed retainer. The teeth will always tend to move back to the old position, so patients have to keep this in mind. So if you've ever considered an aesthetic treatment but you don't know which one is for you, you can watch the video that I did previously up above, and I explained there many or 3 different types of aesthetic treatments that you can get. This is all for today's video. Thank you so much for watching, and please let me know in the comment section below if you ever considered braces.